Hello friends, Naman to Dr. Hanman sir and Dr. Praful Vijayakar sir. Seek the blessings of both Dr. Hanman sir and Dr. Vijayakar sir. So now friends, this season is winter season and you will be experiencing a lot of cough patients, I am very sure. So I thought to rather present some of the clinical experiences and some of the verified clinical tips regarding cough. So let us start with some of the clinical tips of cough. See, a child sometimes presents as cough, and when you ask the parents why, what happened before the episode of cough started, so parents will say, "Sir, we went out and we brought a very beautiful surprise gift to the child, and because of that, the next day the child started coughing. So there was a birthday party and a lot of gift was given to the child, and this child was very excited. He played nicely and he opened the gift. He was very happy, and the next day he fell ill and he had bad cough. So here the rubric is cough by happy surprise. The remedy is surprisingly aconite and mercury by Dr. Fatak sir, keynotes of Fatak sir. Sometimes, because of the hypersensitivity of the air passages, slight temperature variation also will cause the patient to cough. So, the rubric will be cough on entering or leaving room. Remedies phosphorus and Rumex. Sometimes patient will say that, sir, if I am coughing, I have to hold my abdomen and then I have to cough. Why holding is important here? Because patient feels that holding the abdomen, he feels better. So cough pressure on the abdomen ameliorates. That is crocus and drosera. Lot of cough patients will improve by drosera in this. Cough music from ambra and calcarea. So this is very peculiar because of music. Patient is experiencing cough, which is quite peculiar. Why is this that music is sensitizing and causing cough? Music, why is this phenomena? So the explanation of this phenomena is that there is an entity which we call as the Arnold nerve reflex. So there is a branch of vagus nerve which is supplying the external auditory canal. It becomes hypersensitive, and because of that hypersensitivity there is reflex cough. Say for example, any noise, or if you are hearing to music with the earphones on, then you get a cough. So this is cough from music by hyperexcitability of the Arnold nerve reflex. Second is misophonia. Second phenomena is called as the misophonia. What is this misophonia? The certain area of the brain becomes so hypersensitive that any sound which is perceived creates a negative impact or a negative symptom in the body. Example, cough. Any music or any sound will impact a certain part of the brain, causing hypersensitive reaction and causing cough. So this is cough from music. Remedy is Ambra and Calcarea carb. Cough from cold milk aggravation. Cough from cold milk, Antimtard and Spongia. Beautifully you can prescribe Antimtard and Spongia. Cough before menses. argentum nitricum and graphitis. Why? How is the menses connected with cough? So there is an entity which we call as the period flu. In this period flu, what happens is, because a female has experienced hormonal fluctuations, because of this hormonal fluctuation, sometimes in hypersensitive females, there is inflammatory response of the body. Because of this inflammatory response, the body will create certain symptoms like sore throat, cough, or flu-like symptoms. So this is because of the hormonal fluctuations. The remedy is argentum nitricum and graphitis. Cough after measles, if there is any viral infection and if it subsides, patient gets this cough. So cophia and sticta. Then many of the patient now will say that, sir, whenever I take breathe, so whenever I take the air inside during inspiration, I will have cough. So cough at every inspiration. The important thing is every inspiration. With every breath going inside, patient will experience cough. So aconite and sticta. Then many patients will say that, sir, I have this dry cough and I have to vomit, I have to cough and cough and cough, and then it will land up in vomiting. So dry cough until it vomits. Remedy is Mazeria and Stricta. Stricta remedy is coming very often in this context of cough. Many of the, for quick prescribing, you can think of Stricta. So yes, why there is a reason? What is the reason of association of vomiting with cough? Is because of simple. The gag reflex is active because of the cough, which causes vomiting. Another important clinical tip of Stricta is, the patient will say that when cough starts, it will not stop. So incessant cough, which prevents sleep. Incessant cough preventing sleep is Stricta. Cough ameliorated by lying high on pillow. This is because certain patients, they experience postnasal dripping. Because of this postnasal dripping, the pillow has to be raised. The remedy is China and Carboage. Then cough lying on abdomen ameliorates. Lying on abdomen ameliorates is Medorinum and Eupatorum. So this is an abnormal position where the secretions in the lungs are abnormally assisted by the gravity and they are released. So cough lying on abdomen, Medorinum and Eupatorum. Sometimes the cough causes the jerking of the body. So cough jerking the body together. So the body starts a jerking reaction with cough. Agaricus and Theradion. Why is this? This is because of the associated cough syncope. When the patient starts coughing, there is decreased cerebral blood flow. Because of this reduced cerebral blood flow, patient goes into a state of syncope. Because of this state of syncope, patient experiences a brief jerky movements. So that is why this cough jerking the body together. Agaricus and Theradion. So these two remedies have this phenomena of cough syncope leading to brief jerking episodes. Cough after influenza, ammonium carb and sanguinaria. After influenza, if there is persistent cough, think of ammonium carb and sanguinaria. Influenza means any viral illness. You can take upon, you can prescribe ammonium carb and sanguinaria. So periodic cough at same hour. Lyco and Savadilla. Lyco and Savadilla have tendency to get cough at the same hour. Another tip is when the patient cough and cough and cough, and with coughing he falls down. That much intense cough. So nux vomica and phosphorus. So cough and cough and cough and cough and cough. Gradually he falls down. That is nux vomica and phosphorus. Another peculiar thing, cough exertion ameliorates. The exertion is ameliorating the cough. Radium brome and strontium metallicum. Think of these two remedies if you encounter this rubric. See, you should know that such rubrics exist. If you know, then only you will use. So the idea of this video is to just give some of the aspects of repertory which you should know. If you don't remember the medicine, doesn't matter, but you should know that such rubrics exist. So if anytime if you encounter such phenomena or such symptom, you can just recall that this is there, and then you can search the repertory. Cough with eructation, chylibichrome and lobelia. If there is cough and there is associated eructation, think of chylibichrome and lobelia. Cough because of fatty food. Fatty food, magmure and pulsatilla. So magmure and pulsatilla are sensitive to fatty food. If they eat, they will cough. If there is a dry cough and patient wants to put hand over here on the pit of the stomach, which ameliorates argentum nitricum and crocus. So putting hand over here with dry cough is argentum nitricum and crocus. You should be very observant. Patient will not say. You just have to see how the patient is coughing like this. So holding and pressing this. Cough, deep breathing ameliorates. So there was one symptom that cough on inspiration. Now here deep breathing is ameliorating the cough. Pulsatilla and verbescum. Remember this, pulsatilla and verbescum. Deep respiration excites cough. Argentum nitricum, bromium and bryonia. Deep respiration exciting cough is one thing. Argentum nitricum, bromium and bryonia. And cough, deep breathing ameliorates. Pulsatilla and verbescum. Then timing, cough daytime only. Many of the patients are saying this symptom. Cough daytime only, Rumex and Thuja. At night, sir, I am comfortable. I can sleep easily. But daytime is the problem. Rumex and Thuja. Some patients will say cough at night time only. At night only. Never during the daytime. So at night only is ambra, causticum and petroleum. Ambra, causticum and petroleum at night. So cough when the cold air strikes the chest. Phosphorus and Rumex. They are very sensitive people. Phosphorus and Rumex. Very sensitive to cold air. Cough from every cold. This is like if outside there is something cold, patient will get cough, causticum and manganum and sanguinaria. Every cold means if there is a common cold, then patient will land up in cough. We'll say, sir, ek bar, if once this boy or this child has this common cold, it will definitely land up with cough every time. So this is manganum and sanguinaria. Yes. So if the patient is not able to do deep coughing, then causticum and Rumex are the remedies. Choice of remedies, causticum and Rumex. So just you have to, try to just figure out which one is the selection, final selection. Cough, yeah, see, many of the time as per our understanding of the mind of pathology, usually we hunt for fear during cough. So some kind of fear the patient should experience, then and then only the patient will have that cough. But as I already said, cough can happen because of the happy surprise. So cough can also happen because of anger. So there is a rubric mentioned: cough from anger in children and cough in general from anger. So cough in general from anger is chamomilla, antium-tart and sabadilla. In general, coughing from anger is antium-tart, chamomilla and sabadilla. And cough from anger in children is anacardium and antium-tart. So in both the two rubrics, antium-tart is the common remedy. So think of antium-tart when there is anger and it is causing cough. The child was angry, he got this cough. So anger is also one reason which may cause cough. Now strong odors. Patient, if there is a incense is there, that agarbatti is there, that dhoop is there. So because of that odor or strong perfumes, patient will suddenly start coughing. So cough from strong odors, merc phlegm, phosphorus and sulfuric acid. These are the remedies for cough because of strong odors. Merc phlegm, phosphorus and sulfuric acid. Another PQRS of cough is if the patient gets a slight touch on the neck region and he gets this cough. So cough from touch of the neck aggravation. This is either could be a manual touch or either when the patient lies down and the neck portion is touched by pillow or the bed, patient starts having cough. Their cough on lying down is another thing. Then you have to differentiate. Lying down is causing cough or sensitivity of the neck is causing cough. So why is this? What happens? Again, because of the vagal hypersensitivity, there is a branch of the vagal nerve which supplies a part of the neck. So this causes the hypersensitivity of the vagus causes this cough on the touch of neck. Lachesis, belladonna and bromia. So you should know this rubric then and then only. Otherwise, you will take a wrong rubric, cough on lying down, and then you will land up in with wrong medicines, wrong prescription. So also differentiate this, that cough can also caused by the uh, touching of the neck region. Cough particularly at midnight. Aurelia, Drosera and Lachesis. Aurelia, Drosera and Lachesis cough at midnight. When any viral eruptions and the eruptions are receding, then patient will have cough or the child will have cough. That is Dulcamara, Ledum and Pulse. Dulcamara, Ledum and Pulse when the eruptions are receding. Even you can think of herpes if the eruptions are subsiding and after that patient starts cough. Think of Dulcamara, Ledum and Pulsatilla. Cough, dry spot in the larynx. Cough because of the dry spot in the larynx. Conium, Hyoscyamus and Nitromure. These are the common presentation or the common symptoms you will get in these days. Sir, I am having this dryness. Where is the dryness, sir? Inside that throat. What is that inside? It is the larynx. Yes, cough 3 or 4 bouts. I had recently prescribed belladonna. A patient came and just 2 or 3 symptoms, and this was the third observation which I got. कि कैसे खांसी होती है? He came, he sat, and he coughed. So this is 3 or 4 bouts of cough: belladonna, carbovel, cuprum. Deep respiration excites cough: argendum, nitricum, bromium, and bryonia. This I already said. Yeah, certain children will fall sick when they go to a function, marriage function. These days, marriages are happening, so they will go to certain function, family functions, and they will see lot of strange people. Then that child will have cough. So cough stranger at the site of arsenic, beta-carb, and phosphorus. So arsenic, beta-carb, and phosphorus. So cough must sit up. If because of the cough, patient has to sit up, that is phosphorus, pulsatilla, conium, and hyoscyamus. These symptoms will come, definitely will come. Then another observatory rubric: if you are examining the throat and if you ask the patient to just show the tongue, and as soon as the patient protrudes the tongue, he starts getting cough. That is lycopodium. Cough on protruding the tongue is lycopodium. Yes, so there are certain mental aspects also with related to cough that you should know. When a patient experiences confusion of mind before the paroxysm of cough, that is SINA. Before the paroxysm of cough, there is confusion of the mind. Think of SINA. Another observatory symptom of SINA is the child will completely lie still. He will not at all talk because there is fear of coughing. That is SINA. Just remember this beautiful clinical tip. SINA child will lie completely still, will not talk when there is because of the fear of coughing. That is SINA. Then stupefaction or vertigo. Stupefaction or vertigo during cough. Entimtard. Think of entimtard. If the patient comes and says that, sir, when I cough, I get this kala pila दिखने लगता है, or I you know that blackishness comes or dizziness comes. So that is entim-tart. Why is this? Again, this is because of, when there is excessive coughing, the intrathoracic pressure increases. This intrathoracic pressure, it causes that venous return decreases. If the venous return decreases, then again the cardiac output decreases. When the cardiac output decreases, the supply to the brain becomes less, as well as when there is coughing, there is increased pressure in the CSF, again, which causes that feeling of syncope. So the blood supply will become less, so there will be a feeling of stupefaction. This is the mechanism. Another important tip of aconite: when there is coughing, when the aconite patient is coughing, he will not allow anyone to touch. He will cough and cough and cough. He will not allow anyone to touch. So touched aversion to during cough is aconite. Staphysagria, beautiful clinical tip about chronic cough. As you all know, the keynote: croupy cough in winter and sciatica in summer. That is staphysagria. So this is all about the cough thing. I hope you will use these beautiful clinical tips in your prescription, and if you are treating and if you are getting a result or if you are getting cases, just notify me. You can just comment. I would be very happy just to read the comments. So friends, this is all about today's presentation. Thank you.